Hey guys, it's Ashley Tharp, and I'm going to talk about a patient that was seen in clinic today. This patient was a wellness recovery consult for alcohol use. It was a 36-year-old Caucasian male who appeared his stated age. He came in through the ER 2 days ago for acute alcohol intoxication. The patient stated he went on a bender and drank a fifth of Fireball whiskey, half a bottle of Maker's Mark bourbon, several shots of tequila, and a 12-pack of beer, with his last reported drink being 2 days ago. The patient stated that he started drinking a lot more after his brother passed away a year ago, and that really the complications and the unexpected nature of his brother's passing has left him with a lot of emotional distress. He stated that prior to the death of his brother, he only occasionally drank, like maybe a couple times a year, and it was more of a social thing. He has no past history of any other substance use. He has absolutely no past psychiatric history. He also was reporting feeling differently after his brother passed away. He no longer finds pleasure in most of the things that he used to. He doesn't want to be around family or friends anymore. He's much more reclusive and withdrawn. His family dynamics have shifted and they've been impacted because of his alcohol use and his depressive moods. He said he has trouble engaging with social activities. He has trouble with his attention span and concentration. He finds himself drifting often in his thoughts. He said he wanted to get some help for his alcohol use, and if we could help with that depression too, that would be great. He reported 8 out of 10 on the depression scale. He denied any suicidal ideations, intent, or plan, no homicidal ideations. He was awake, alert, and oriented to person, place, and time and location. As I mentioned, no past psychiatric history, absolutely no psychotropic medication history. The only substance abuse history that he has is this progressive alcohol use that has continued over the last year. He reports now he drinks pretty much nightly to help him fall asleep. Denies any past DTs, no withdrawal seizures, nothing of that. He does report cravings today, and he had withdrawal symptoms today of nausea, diarrhea, some mild tremors, sweating, restless legs, and insomnia. No hallucinations, no other substance use. He reported his support system as his family, his coworkers, and a close friend. So his MSE, he appeared his stated age. He was thin, unkempt, and with dirty clothes and unshaven facial hair, but he was dressed appropriately for the season in a t-shirt, jeans, cowboy boots, and a jacket. His mood was nervous but pleasant. He was reluctant to talk at first, but cooperative as the interview continued. He expressed some anger and some guilt when discussing his brother. He was able to maintain adequate eye contact, and rapport was easy to establish. His affect was congruent, and the patient often became tearful and reported periods of emotional numbness that lasted hours to days. He had no abnormal motor activity. His speech was clear with regular rate and rhythm, soft volume, and a flat tone with fluent English. He denied any hallucinations. There were no delusions, obsessions, phobias, or themes. His thought form was linear, and emotional distress was elicited when discussing his brother. He, like I mentioned, had no suicidal or homicidal ideations, intents, or plans. He was awake and alert and oriented ×4. He was aware of current events. His recent and remote memory was intact. His cognitive function was intact. He completed serial 7s. He spelled a world backwards correctly, and he had appropriate abstract thinking. Insight was intact as he had knowledge about his addictions. Judgment was intact as he was able to safely participate in his plan of care, and impulse control was poor as he had difficulty not engaging in addictive behaviors. So he was diagnosed with alcohol use disorder severe, alcohol withdrawal, major depressive disorder unspecified. We needed a little bit more time to tease out all those specifications, such as anxious, mixed features, melancholic features, atypical, and so forth. But he definitely met the criteria for major depressive disorder based off of his reported symptoms. His treatment plan included starting him on an SSRI, Prozac. You can read more about that in my paper. He was on a CWA protocol. He was given education about CBT, and he actually agreed to go to an inpatient rehab program that was specializing in alcohol addiction after he's medically cleared and discharged from the facility. After he completes that rehab, he will then be referred to the Wellness Recovery Outpatient Clinic and be managed and followed for his psychiatric conditions. So thanks. If you need more, just read about it in my paper. Thank you.